Hey health warriors, chronic illness is one of the biggest threats to both public health and the healthcare economy, and it's not going away. Today we're breaking down the financial burden of chronic disease and how case managers are stepping up to coordinate smarter care, reduce hospital use, and help both patients and systems stay afloat. Chronic illnesses like diabetes, heart disease, COPD, and kidney failure affect 6 in 10 adults in the US, and account for 90% of the nation's $4.3 trillion in annual healthcare costs. Frequent ER visits, hospitalizations, and readmissions, missed workdays, disability, and long-term loss of function. These patients often face complex medication regimens, multiple providers, and major gaps in care, especially after discharge. Why costs spiral without support? Poor medication adherence, no primary care follow-up, unaddressed social factors like food insecurity, housing and transportation, fragmented care between specialists, lack of education about managing symptoms at home. Without guidance, patients end up in crisis over and over again. How case managers reduce chronic care costs? This is where case managers make a massive impact. They connect patients with primary care, specialists, home health, and rehab, ensuring care plans are clear, realistic, and followed through. They reconcile prescriptions, educate on side effects and adherence, and address affordability or access issues. By identifying red flags early through check-ins or home monitoring, they prevent avoidable emergency department visits and admissions. They set up telehealth or urgent care alternatives and help patients know when and where to seek help. Case managers arrange transportation, food, insurance navigation, or caregiver support, and partner with community-based organizations for wraparound care. They teach self-monitoring techniques, help patients understand their conditions, and recognize warning signs, build trust, and encourage proactive health behavior. With case management, care becomes personal, proactive, and preventive instead of expensive and reactive. Bottom line, chronic illness is costly, but smarter care can cut the waste. Case managers are frontline strategists, not just connecting services, but changing outcomes. Their work keeps patients healthier, longer, and helps healthcare systems spend where it truly matters. How has your team made chronic care more efficient? Share your strategies in the comments. We're building better systems together. Like, subscribe, and follow for more practical solutions that fight costs by improving care. And remember, manage chronic illness smarter. Spend healthcare dollars better.